Therefore, the initiative was named Challenge and Support. Challenge where possible, support if needed.
Welcome to the Coaching Revealed podcast. I'm one of your hosts, Austin Matzel. In this episode, Executive Director Jeff Hull speaks with Dr. Lara Solms and Dr. Anne Pagter, who share their inspiring journey of bridging clinical practice with academic research to establish an evidence base for healthcare coaching. Dr. Pagter, an associate professor and pediatric hematologist at Erasmus Children's Hospital, explains her motivation to bring coaching to healthcare, which from peer feedback required solutions to be evidence-based. Collaborating with Dr. Solms from the University of Amsterdam, they developed a coaching model based on growth, challenge, and improvement. Dr. Pagter and Dr. Solms detail their pioneering work in conducting randomized controlled trials, RCTs, which are a gold standard in medical research, to evaluate coaching's effectiveness. They discuss their methodological challenges and their innovative solution of a waitlist control group, ensuring support for all participants while still generating robust data. Their foundational research has expanded from this initial work to include multiple RCTs in the Netherlands across healthcare professional groups, including physicians, nurses, and medical students. If you are interested in learning about research or submitting proposals for coaching research grants, please go to theinstituteofcoaching.org to learn more. And now, our conversation with Lara Solms and Anne Pagter.
Well, hello, everyone, and welcome to Coaching Revealed, a podcast from the Institute of Coaching. My name is Jeffrey Hull. I'm the Executive Director of the Institute of Coaching, and I am super excited to be here for our series on research in the coaching space. And we have two amazing researchers with us today. Dr. Lara Solms and Dr. Anne Pagter are here, and they have an amazing story to share. I'm not going to dive into it myself. I'm going to let them tell it. But I do want to share with you that they have been involved with the Institute of Coaching. They were recipients of a grant from the Institute of Coaching. The research that they've conducted over the past couple of years and recently published is really profound. And I guess I would just say it's an example of exactly the kind of thing that we at the Institute are doing our best to support and promote and bring to the coaching community. So I am super excited to have my two doctors in the house, Lara and Anne. I'm going to start by just giving a quick bio because many of you around the world may not have heard of these two amazing coaching researchers. So just a quick bio, and then I'll let them add to it. But Dr. Lara Solms is an assistant professor in work and organizational psychology at the University of Amsterdam. And it was her PhD work where she focused on the effectiveness in coaching for medical professionals and the psychological mechanisms that underlie positive coaching outcomes, where she had an opportunity to work with the Institute of Coaching and also with Dr. Anne Pagter, who is an associate professor and pediatric hematologist in the Erasmus Children's Hospital in Rotterdam and the William Alexander Children's Hospital in Leiden in the Netherlands. And she is also responsible for founding something called the Challenge and Support Program, which is a program for healthcare that is focused on improving patient care by amplifying professional personal development of medical professionals and sustainably contributing to a safe and stimulating learning and working culture. And coaching is a very, very big part of that, which we're going to talk about. So they have both super impressive backgrounds, and I've had the opportunity to meet them both in person, and they're just genuinely nice people on top of being brilliant. So welcome to you both.
Thank you.
Thank you.
It's so exciting to be able to talk to researchers that have been supported by the Institute of Coaching and have actually conducted what we consider to be some really profound work in the coaching space. And I think that the best place to start is maybe a little bit of the story of how it all came together. Our folks that listen to this, I think they love to hear how partnerships get formed, because a lot of the best research is in collaborations. How did you guys meet, and how did you even come up with the idea of studying coaching in the healthcare space?
Yeah, thank you. Let's start, and hopefully Lara can join in since Lara was the pioneering researcher in our project. And how did it all start? Really in the workplace of healthcare. Being a resident in healthcare, I was able to get to know executive coaching as an fostering support or support to foster professional development myself. And I was really familiar in training my technical skills, training my professional attitude in healthcare, but not the professional development and personal development, which is, in my opinion, as important as the technical skills to become a good healthcare professional and to give optimal care. And after that training myself, I was so inspired. I asked my supervisor, would it be possible to evaluate if we can make a program for my colleagues, because I think this would really add to quality, to improvement in quality of care. And he said, yeah, that's a good idea, but please make sure that we will have evidence-based, evaluated, validated support programs, because otherwise, what are we doing and how can we really improve it and sustain it for the future? So that was the start. And then we said, we're just simple doctors and we need some experts on the coaching field to bring not only workplace, so practice, but also research expertise together. Because then we will make far more impact than both of us on our sides alone. So we bridge that connection with the experts from the Work and Organizational Psychology and the University of Amsterdam. And that was really the first seed in growing the challenge and support forest we're building now. And Lara was the first PhD student in this project, where we evaluated the effect of coaching interventions on the workplace. What I think is important to start with, not our scientific knowledge or our ideas, but we started with the first question to all our colleagues: what do you need for your professional and personal development? And they came up with, oh, we need successful, qualitatively good rated coaching. That's where the whole adventure started. And now we evolved towards a nationwide program where far more researchers and expertise fields are connected. But I think this is a good way to move on to Lara, because she was the one building the first steps.
Yeah, but I mean, I don't have too much to add to that because, how did we meet? Yeah, we met, me being indeed the first PhD student. And I still remember the interview I had with all you guys about coaching and healthcare. And I have to admit that at the time I wasn't, I didn't quite know yet, I think, what coaching was. And I think over the last couple of years, like almost 8 years now that I've been doing research into coaching, I think we have also built a nice evidence around what coaching is and how it helps healthcare professionals. Yeah, certainly a lot more than when I started my PhD with very, very little knowledge about the topic.
I'm curious, Anne, what was the reaction when you thought about doing coaching as the modality? Because it could have been training, it could have been a lot of different possibilities. And I know from working at the hospitals in the Harvard system, the doctors don't automatically get excited about coaching. So I'm just curious how you brought the idea of coaching to them. And then I get that you wanted to do a science-based approach, which makes perfect sense because they are scientists in their training. So to have it be validated, to have it be evidence-based, and then that makes sense to bring in a researcher like Lara, who is doing a PhD in that space. So that all makes sense. But I'd love to hear, did you have any resistance to the idea that we're going to bring coaching into the healthcare space?
First of all, I think I learned a lot. Just being a resident in pediatrics, you're fulfilled with networks of professional expertise in different areas of healthcare, but not specifically with the people in the organization, like HR experts, like quality of care experts. They're more hidden in the organization. So after that first contact with my own supervisor, we created a network of people around healthcare professionals to prepare all of this. And that was so useful for me and very inspirational, because you get to know other organizational parts, other insights, other expertises, to look at the same challenge from different perspectives. And indeed, we at that time, this was almost a decade ago, we definitely observed resistance towards all kind of support for professional and personal development. Soft skills, they were named. I prefer to name it human skills, like you need technical skills and human skills to give proper care. But at that time, a lot of people looked at support like this as, if you have a problem or if you are a problem, coaching is a treatment or a solution to fix it. And we tried from the beginning to change that point of view towards the more sports point of view, how to continuously improve, how to foster your talents, your resources, your quality of your work, not only for yourself, but also because you are a very important person in the whole system of healthcare professionals, and you're responsible for the overall performance of our whole team. So we try to find a shared aim or a shared goal, and we try to focus on growth, challenge, and improvement instead of fixing a problem. Of course, we also would like to help the people who are exhausted or burned out or do have a problem where coaching can be helpful. But we tried in all the approaches to focus on growth and the challenge. And therefore, the initiative was named Challenge and Support. Challenge where possible, support if needed. The importance of the scientific evaluation in place, because in the research evaluation, we clearly observed that a lot of people struggled with challenges on the side of problems or burnout, where coaching could be really helpful. That helped us to evaluate or to change it into the future, and to improve the program even more.
No, that makes perfect sense. So you tried to shift the mindset from fixing a problem to elevating your capability and your performance.
What was really inspirational to me, that spontaneously a lot of colleagues joined us who had a background in top sports. So they share their stories, and I'm really aware that in sports sometimes you can also maximize or put your potential in the overdrive. But here they share their story to optimize the eventual team performance by investing in yourself. And I think that's really hopeful for healthcare future if we look at it that way.
Ready to advance your coaching practice? Join the Institute of Coaching and tap into the world's leading resource for coaching science and professional development. With over 4,000 members across 130 countries, the IOC offers invaluable networking opportunities with an elite global coaching community and innovative learning to broaden your knowledge and keep you at the forefront of coaching best practices. Engage in cutting-edge learning events with world-renowned coaching scholars, from webinars and seminars to discussion groups, research projects, and more. Try any membership free for 30 days. Use promo code IOC Podcast and visit instituteofcoaching.org/join to get started.
Beautiful framing. I love that, because it is true. And I also work in hospital settings a lot. I find that it's easier to coach if you go in telling them about leadership coaching, then there's an opening for that, because they want to be a leader, because they have a team, and then they want to, it's related to getting promoted. But if you go in and you tell them, I'm just going to coach you on your burnout or something like that, there's a negative connotation of physicians in particular, nurses too, but they sometimes resist, like, oh, I don't need that. I can do it myself. It's very self-sufficient, because of course these are very achieving folks that decide to become doctors or nurses or those kinds. So Lara, let me ask you about the research side. You did this as part of your PhD, right? So when you came into working together, what was the process by which you created the protocol and the study?
How we started, almost like Anna said, almost a decade ago now, was the area in terms of coaching research was that there wasn't much out there yet in terms of effectiveness studies in the field of healthcare for doctors specifically, but also certainly not for nurses. So our first goal with my PhD and our project was to see if, like Anna said, see if we can evaluate the effectiveness of coaching in terms of does coaching also reduce burnout symptoms, but also increase strength, personal resources, work engagement, well-being, and ultimately possibly also performance altogether. And this, I think, is the starting point how we went about. And we started with an intervention study that was at the time not a randomized controlled trial yet. But we followed that up over the years with a better design, an RCT study that we are currently have submitted for publication as well. So there is some progress ongoing in terms of effectiveness studies that we have conducted as part of the Challenge and Support program. But we've also done a little bit research around the process of coaching or the working mechanisms of effective coaching in or for healthcare professionals. If that answers your question.
Yeah, no, it does. I'm curious how when you were a PhD student, where did you get the skill set to actually know how to craft the methodology and were you taught how to do that? Or because a lot of our coaches are like, oh, I'd love to be able to do research, but I don't really know how it works.
Yeah, I mean, that's a good point. Of course, I was embedded in a multidisciplinary team with a lot of expertise from both organizational psychologists and medicine on the other hand. But I also had a background as a social and health psychologist with specific focus on research. So I am also trained in quantitative research. So setting up an intervention study around coaching was something like methodologically speaking that I was trained for as well. But then again, you do need the expertise, obviously, from healthcare and work in organizational psychology to make sense of and put your skills into practice and come to a good research design and a good methodology, questionnaires and everything that is part of that research cycle. And that's not something that you can do alone, but that you need a team for.
Well, that's what makes the combination of the two of you so special, because you have someone who's a practitioner and understands the environment that they have to perform effectively with patients and colleagues. And then you have someone like yourself, Lara, who has the research capability. And so it's bringing the two together that is really very special. I'd love to hear a little bit of the backstory of how you decided you could actually do a random controlled trial. I know you say RCT and everybody's like, what's an RCT? So, those of us that work in this space will recognize that. But for those of you that are listening to this podcast and you're thinking how exciting research is in the coaching space, and it certainly is, there's actually been very few real random controlled trial studies of the effectiveness of coaching. And it's partly because it's very difficult to do a random controlled study of anything, because fundamentally you need two sets of participants. You need the random control group and you need the folks that are going to get the coaching or the drug or whatever it is. So if you're doing something quantitative in a medical situation, it's also challenging, but it may be a little bit easier. But I know colleagues of mine who have talked about doing RCT, they always struggle in coaching because everybody wants the coaching. So it's very hard to come up with a group that doesn't get the coaching. So talk to us a little bit about how the random control trial even came into existence, because it's really profound in that it actually really starts to show the distinction between the performance and the capability and the capacities of people who do get coaching versus folks that are unfortunately, hopefully they do maybe the next time around, but the folks that are not part of the coaching intervention.
Maybe I can say something a little bit more like from the beginning, methodology speaking, and then Anna, you can follow up on more the strategic and planning aspects. But what we did initially in one of our first studies is that we weren't able to randomize people into either, like you explained, the intervention group that would get immediate coaching, and then like another group who would like a waitlist control group, what we usually call it, that have to wait, a couple of months, and then they can start coaching. So initially we weren't able to do that due to like logistical reasons. But what we saw in the data is that when we asked people to, are you interested in coaching? Would you like to participate? And then they say yes. We saw that on average, people were relatively exhausted. They had relatively little resources. So there was some sort of, I don't want to say, I'm not sure if bias is the right word, but there was some sort of pre-selection effect that you get when you don't randomize people, which could also be due to the fact that while there is some sort of need for development, whatever kind of goal physicians at the time have, but they may be different in one way or the other than like someone who is not interested in an intervention at all. So we did see that going on based on the first study that we did. Which also meant that there was need for a better, like a controlled study to take out that bias, if you want, and really more purely estimate the effects of the intervention. And this is how also from a research side, the need for an RCT basically came about. And then there was a lot of organization involved in terms of recruitment of different hospitals in the Netherlands. And a lot of teamwork in that sense. Anna, maybe you want to share a little bit about how that looked behind the scenes?
Thank you. Yeah, I think it's for all the coaches listening who are interested in research, as you just said, Jeff. I would like to give the advice to join a network, because doing this on your own is hardly impossible, I think. And I learned a lot, and we created much more impact by joining, not only on the coaches side, so all the coaches were joined in our network, but also on the research. And this was really pioneering in the start. So first doing this cohort study, and then we realized like this whole initiative was born in the front line of care, and we're really used to randomized controlled trials to evaluate treatments. And also some of the resistance was concluded with, there's no real evidence on the effectiveness of these kind of interventions. So we wanted to answer that question from practice via the most robust way of doing it, namely a randomized controlled trial. So there we just did it. And I think that's the funny story, or I think it's a really promising story actually from the challenge in sport. We did it. And during progressing all of this, we came up with new ideas, which we are evaluating now. And thereby we created a learning system. So this randomized controlled trial is indeed a study with a start and an end point, but it's far more one of the bricks in the whole solution to retain our engaged people in healthcare. So I think that pioneering, I really like that phase, and just going to give hundreds of presentations to share this story and to ask people, do you want to join? And then in the program team, we really had to organize properly that the randomization was correct and everyone was followed and were sent reminders and so on. So that was really a good collaboration between the research team and the program team from this initiative.
How does it work in terms of the people that are part of the control group?
Yeah, so we invited everyone in care teams to join our program with the connected RCT, and who was interested entered in the program. They filled out their first questionnaire, and after that they were randomized. So everyone who was interested to join was included, and after their filling out the questionnaire, they were randomized in immediate start or waiting list control. So everyone received eventually the coaching, but the control group has to wait for 9 months.
Ah, okay. So that's the magic formula.
Now and otherwise it wouldn't be ethical, right? If you would give only half of the persons the support, we now know that there's enough evidence to say that it will really be helpful to improve and foster your engagement and reduce exhaustion. So yeah, I would like to offer it to everyone, but we needed this longitudinal setting to have a proper randomized control design. To add on that, there were lots of doctors, like ambassadors on the work floor, who were the ones coming up with teams who would like to join. And that were really important people in our network, because those front runners are the ones who are paving the path for a lot of colleagues to get to know these kind of initiatives. And now we see that a lot of nurses, after we did this first randomized controlled trial among physicians, there were some front running or leading nurses can come up and say, we would like to have a comparable initiative, because we really need that in the setting of all the challenges in staffing crisis and increased exhaustion and increased rates of leaving the job. After this first RCT, we came up with the next one, the randomized controlled trial among nurses, where we are really happy to collaborate with the Institute of Coaching. Next, medical students came up and they said, we also need this in our career decision-making process to have a proper and a sustainable decision on career paths in healthcare. And from that team, a lot of PhD students came up and they said, excuse me, we also would like to join. So from this first RCT, we now have 5 RCTs in place where we evaluate the efficacy of coaching in specific healthcare settings. And I think that's the fundament for the Challenge and Support network, where we would like to have a learning system to build continuously on improving optimal support for all of us. So the doctors can also learn from the insights we got from the students and so forth.
Amazing, amazing evolution when you think about it. It's like an ecosystem that grows, that is a success, and it builds on itself. It's really amazing.
And from this first start with Lara, we created the Challenge and Support National Foundation, which is the overarching foundation with the aim to support, retain, and empower our healthcare workers overall across the whole country, because all the organizations can also learn from the insights we get from other organizations. And I think it matters now more than ever to join forces and to learn data-driven for validated types of support.
So Lara, when you were first starting this project, did you have any idea how big it would get?
No. I mean, I knew that Anne was ambitious. I knew that the project was ambitious, but no, I mean, for sure not. But I think the focus on doctors, I think at the time it made sense, also given Anne and Matthijs, your supervisor's background. But I think it's super nice to see this development to other target groups as well. Also target groups that also in the healthcare context often maybe have less immediate access to these kind of support initiatives, like PhD students, like nurses. So I do really love this, what like how you said, evolvement or evolution towards other professional groups within healthcare.
Now it's covering the entire country in the Netherlands, right?
But I think the basis from the robust fundamental research quality, together with the front line of care and the workplace connection, that is really one of the main facilitators in how we can continuously build on this movement. Because if we did not have that, like what Lara was doing is trying to get all the different expertise also from other departments and faculties together, then we would never have the proper level of quality to really add to the field of coaching science.
Yeah, it's the credibility factor. I mean, when you're dealing with the healthcare space in particular, they may have a sort of natural intuition that coaching sounds great, and that coaching might be a good thing. But in terms of actually choosing to spend time and make a commitment to do that in your very, very busy work, it really does help to have it validated.
Yeah, and also on the organizational and policymaker level, because if yes, coaching is really important to foster the individual healthcare worker, but it's also very important to collect all the data, because if we collect all the data, we can really say something on themes, on perspectives, which are really important to improve our healthcare system and our, for example, human capital support. So I think there a robust data-driven fundament underneath is essential to also have impact on the other stakeholder levels in the healthcare overall.
That's great. I'm curious, Lara, as you work now in the work and organizational psychology space, and probably you're not just in the healthcare space anymore. Can you extrapolate like all of your experience from that RCT and the study that has evolved and speculate about coaching in the workplace in general or organizations in general? How do you see it evolving?
Yeah. So yeah, maybe a little bit in terms of the background. So like you said, like my focus of my PhD was indeed on coaching in the healthcare field, but now what we like the department I work in at the University of Amsterdam looks more broadly at how individuals, teams, organizations work productively, but also stay happy and healthy while they do it. So my focus has, as you already put it, a little bit shifted also a bit towards more the broader organization and how interventions like coaching, but also other type of interventions can support employees, organizations in terms of well-being and productivity. We think about coaching. I think the past 2 decades, we saw that most of the research that was done has been done on effectiveness of coaching. And that is also how our RCT, how we started in terms of the intervention studies in the field of healthcare. But I think the last 5 years or so, the focus has shifted a little bit more towards process research, trying to better understand how coaching actually works, because so much of coaching happens behind closed doors that it's really difficult for researchers to actually better understand like how positive behavior change in coaching comes about and what the role of the coach is, but also what the role of the organization or the coachee is in making that behavior change happen. That is, I think, happening right now in terms of coaching research when you look at what's the type of research that is being done and being published. And I think the role of the organization specifically, when we think about the role of HR, the role of management, of all the stakeholders that are involved in the coaching process, I think that is something that is also being more and more included in coaching research studies, because I think that can make or break whether coaching is successfully implemented and what the effects of coaching can be for the individual, but also the team or organization more broadly. So I think we're going a little bit more towards that direction and away from pure effectiveness studies. Yeah, so I think it's a very exciting time for coaching researchers because there's still so much, unknown about, what happens in coaching and the factors that play an important role.
So here's a difficult final question. How do you both respond to the evolution of artificial intelligence entering into this space? Both medical, health, coaching. I mean, do you think it's a good thing or do you think it's problematic? Is there a place to have like AI coaches integrated into the research? I'm just curious how you folks, because you're in, you're really in interesting different dynamics, both in a healthcare setting and in an academic setting, in a workplace organizations. And it's such a topic that everyone is interested in these days, and I don't know that you'll have the answer, but I'm curious what your thoughts are.
You want to go first, Lara?
It's obviously a development that you cannot ignore or miss. Also AI in coaching and the role of chatbots, AI-supported coaching modules. So I think it's super interesting also when we look at even ChatGPT as some sort of therapist or counselor, and what the possible benefits of that can be, but also what the downsides or even dangers can be of that reliance on AI for mental health support. I think it's a very difficult, tightrope to walk. But I do think it offers, if it's well done and implemented well into a coaching, into face-to-face coaching, for instance, like during sessions, let's say a chatbot coaching or AI supported coaching, I think it can really nicely support like habit formation, like small behavioral experiments, and the kind of mechanism possibly that make coaching work in the long run. So I think there's a lot of potential, but there's also dangers, and I think we still know very little about that side of it. And I think it evolves so quickly that it's hard to stay on top of the developments. But I do think it's something that's hard to ignore, for sure, for professional coaches, but also for coaching researchers.
Yeah, no, I agree. I'm curious, and do you find, I had a coaching symposium in San Diego not too long ago, and there was a telemedicine physician and a coach, and they talked about using this technology, and they were convinced that the healthcare space is actually one of the most ripe environments for using some of these AI tools. I'm curious what your thought is on that.
Yeah, I think it's a very exciting and challenging time now with all the broader technological innovations and AI innovations to improve healthcare, but also to sustain proper care in all the challenges we face with staffing crisis and increased demands in healthcare. As we also discussed in the Institute of Coaching International Network on Clinician Wellbeing and Research, we also face the challenge, if everyone is so overloaded in workload, then it's really hard to have the capacity to implement innovations or to even think about all the barriers and the facilitators needed to really use this. So the capacity of change or the capacity of innovation is a competence we really need in healthcare, which is not implemented in our current training programs. So I think coaching can really be of benefit to foster our own engagement, our own curiosity, and our own capacity of change to use these kind of new technologies properly. Because yes, I think a lot of technological innovations and AI can really be of help in the daily healthcare work and good care for our patients. But on the other hand, do we not all want a connection with a human being when you're in trouble or you need support? And I think hopefully AI and technical innovations can support us to strengthen our qualities as human-to-human connection, because I think that's really also one of the essentials in giving proper care. And I hope we can all help ourselves to foster that.
Well said. Very well said. So I'll ask you one last question, and both of you, just your immediate thoughts. For anyone that's interested in getting involved in a research project around coaching, as a practitioner or as an academic, I mean, you've now had like a decade of this evolution, and it's been extraordinarily successful. What would you say for advice? Like, what would you, if you were embarking on this kind of, not necessarily in healthcare, because as Lara was saying, a lot of this is now moving beyond just the healthcare into the workplace. What kinds of advice would you give to someone who's interested in getting involved in this kind of research?
Join a network with robust researchers on one side and highly qualitatively rated coaches on the other side. And I think we are pioneering since last year with that network on clinician well-being and research via the Institute of Coaching. And there we do not have like a clear aim. We would like to do this and this project together. We started again bottom up with all those experts in the coaching field. What do you need? What could be a topic we should address together? And I think, yes, that takes long and it's a long time of preparation, but I think in the end it will definitely increase impact. So to anyone who's interested in types of research, we have a healthcare-based network available via the Institute of Coaching. And I think the Institute of Coaching would be an excellent opportunity to find colleagues who are also as interested or ambitious as you are to collect all research interest and to join forces. Yeah, I think building strong networks is the key to learn yourself, because you can, as a coach, you're a lot of times you're autonomous in your work, and you can learn a lot by sharing and being vulnerable with others, and also via the data-driven approach and the scientific part. So yeah, building networks.
And maybe to add to that, I think it's especially from a research perspective, it's like so valuable to have the input from practitioners, coaches, people from HR, anyone who's working with clients in the real world out there. So I think don't hesitate if you have an idea or like something that you feel like that should be researched. I'd say just get in touch with Anne or me. This is really something that as a researcher, we don't have easily access to these ideas, and also this need in this real world need basically of what is important to research, what are things to consider. So I think this like combined approach of practitioners meeting scientists, that's something we maybe need to do much more in research as well, and have to focus much more on to also produce better research. So yeah, that's maybe just a call basically to everyone as well, to have that, at least in the back of their minds as well.
Well, I love having the two of you on the podcast, and it's a joy to have an opportunity to see how this project and the research has evolved, because to my mind, what you've created over many years is actually just a beautiful model for the kind of collaboration that we want to foster. For those of you that are listening, if you're interested in research, get in touch with me directly through the Institute or through LinkedIn, and I'll be sure to connect you up with Lara and Anne, and we wish you all the best. But these two are proof in the pudding that it can be done. Even a random control trial can be done. So thank you so much, both of you, for taking the time. And I just want to wish you the best as you continue on to have a huge impact in the world of healthcare and coaching both. So wishing you all the best.
Thank you for listening to this episode of Coaching Revealed, brought to you by the Institute of Coaching. You can learn more about the Institute on our website at instituteofcoaching.org. You can stay up to date with new episodes of our podcast by liking and following Coaching Revealed. You can also find us on social media on LinkedIn, Instagram, and X with the handle Institute of Coaching. We also love hearing from our guests, so please reach out to us with thoughts you have on this episode and any questions you have about coaching. Until next time, this is Emily Tarani with Coaching Revealed.